Our evidence-based research for our nurse residency project is over the effects of vitamin C on the prevention of atrial fibrillation. This is researched and presented by Katie Crooks, Olivia Myers, Molly Schmidt, Leah Terrell, and Sarah Winton. All of us work at St. Luke's Hospital on the Plaza. We work on 4 South, or SICCU, the Surgical Intermediate Cardiac Care Unit. On our unit, we often take care of patients post-op after cardiac surgery. Our cardiovascular surgeons perform a number of different surgeries, including cardiac bypass surgery, aortic aneurysm repair, and heart valve repairs and replacements. Post-op atrial fibrillation often occurs to our patients after surgery due to the oxidative stress and inflammation placed on the heart. Our topic is, does the use of vitamin C reduce the incidence of post-op A.fib in cardiac surgery patients? PICO is a mnemonic that helped guide our clinical question that we then supported with articles of evidence-based practice. Problem: cardiac surgery causes inflammation and oxidative stress in heart tissue, thus increasing the risk for post-op AFib, leading to increased incidence of stroke and other adverse effects. So our population are post-op cardiac patients. Intervention: vitamin C, a strong antioxidant that fights free radicals produced by oxidative stress, can be given before, during, or after surgery to help prevent AFib. Comparison: vitamin C supplements versus no supplements in open heart surgery. Outcome: AFib will occur less often after cardiac surgery with the use of vitamin C, a non-harmful agent, among other post-op medication regimens.
Postoperative atrial fibrillation has a high occurrence in cardiac surgery patients. Being nurses on the SICC, we see this quite often. Oxidative stress triggers cellular changes in the atrial tissue. This disrupts the electrical activity and leads to postoperative AFib. AFib presents many risks and delays discharge. We currently have an amiodarone protocol set in place due to the high prevalence of this issue. Amiodarone has many risks that come with it, including pulmonary toxicity, bradycardia, blurred vision, along with a high risk of phlebitis. St. Luke's currently does not have a protocol involving vitamin C for postoperative atrial fibrillation, and we really just wanted to aim our research at alternative or additive approaches to help with these occurrences.
Through our research, we were able to discover articles that supported our topic. This article is titled, "Sole and Combined Vitamin C Supplementation Can Prevent Postoperative Atrial Fibrillation After Cardiac Surgery, a Systemic and Meta-Analysis of Randomized Controlled Trials." Key points in this article is that it reviewed 13 trials involving 1,956 patients to evaluate the effects of vitamin C supplementation as single therapy or in adjunct with other therapy to prevent postoperative atrial fibrillation. Of that, 48.8% of patients receiving vitamin C supplementation developed post-op AFib, and 51.2% of the controls developed post-op AFib. Studies showed a significant decrease when vitamin C was used in adjunct to a beta blocker and a statin. It also was associated with a shorter ICU length of stay. Limitations with this article was an over or underestimation of true incidence of post-op AFib due to sample sizes. Some vitamin C findings was that there was no significant adverse effects observed in the analysis. However, also large studies have accumulated evidence that excess use of vitamin C intake may cause kidney stones in men. Overall, in this article, based on this, vitamin C as an antioxidant may reduce post-op AFib by reducing the inflammation response and downgrade oxidative stress enzymes. With its synergistic effect of vitamin C with a beta blocker and or statin, it can strengthen the prevention effects of post-op AFib.
This article looks specifically at patients undergoing CABGs and the rates of AFib. There were 100 participants. The average age was 61 years old. Half of the participants received no vitamin C, and the other half received vitamin C orally, both before and after surgery. They then monitored the patients for 72 hours. Results showed that AFib occurred in 16 out of 50 who did not receive vitamin C, compared to 4 out of 50 that did receive vitamin C. The overall hospital stay was shorter in the group that received vitamin C. Based on this article, vitamin C may be used to decrease the likelihood of post-op AFib, as well as decrease the length of hospital stay in patients undergoing CABGs.
One article we looked at was the preventative use of ascorbic acid for atrial fibrillation after coronary artery bypass graft surgery. This was a randomized, double-blinded trial. 314 on-pump CABG surgery patients were studied. 160 of them received 2 grams of vitamin C IV 24 hours preoperatively, 500 milligrams every 12 hours IV for 48 hours in the ICU, and then 500 milligrams every 12 hours orally for 48 hours. 154 of the patients received no vitamin C intervention. Only 7.6 of the patients receiving vitamin C developed postoperative afibrillation. However, 7.8 of them who did not receive vitamin C developed post-op atrial fibrillation. There was not many differences between the two groups. This concluded that prophylactic use of vitamin C does not further reduce postoperative atrial fibrillation in on-pump CABG patients.
Okay, so our last Article 4, essentially showed that there needs to be some further evidence to kind of support our claim. This article looked at 15 trials with a total over 2,000 subjects. All these subjects were considered high risk for AFib. 14 of the trials specifically looked at how vitamin C can help reduce the incidence of post-op AFib. And then the other trial looked at how AFib can help reduce the reoccurrence of AFib after cardioversion, which, if you don't know, cardioversion is that procedure that has electric shocks to the heart to restore that normal sinus rhythm that we like. And so kind of going over our trials, the ones that were looking at post-op AFib, they were actually throughout various countries. The U.S. had 5 of these trials, and then the other countries include Iran, Russia, and Slovenia. The U.S., interestingly enough, the U.S. was the only country that did not show really a correlation of a decrease in incidence for post-op AFib after using vitamin C. But the other countries, the other 3, they all did show a decrease in post-op AFib. So that also correlated with a decrease in hospital stay for all 3 of those countries as well. The one trial that looked at the cardioversion and the reoccurrence of AFib after that was held in Greece, and that did show a decrease in reoccurrence after patients were given vitamin C. So one good point to note in that the article addressed was that in any of the 15 trials, there were not any adverse effects shown. So that's a good point to note as well. So to wrap it up, I hope our presentation kind of gave you all a better image of what vitamin C may or may not do for AFib in our post-op cardiac patients. Our articles, we kind of wanted to give you a variety of, support, not support, and articles that were inconclusive. But because AFib does complicate so many of our post-op cardiac patients, and vitamin C very well may be a solution to help preventing that. And we see it so much on our floor that this question and this topic really intrigued us. Number one, because vitamin C, it's inexpensive. If patients are, with further research, shown that, they'd need to take a week before their procedure or a couple of days before their procedure. Patients can take it no problem. It's not a big deal. And it's, it's not expensive. And then number 2, it's safe. So, it's not a weird medication that patients don't know about. It's an essential nutrient. And so it's not, there's no concern really for reactions. I think all of us on 4 South have seen the firsthand effects of amiodarone to patients' veins. It easily irritates their veins. It can infiltrate and it gets swollen and it's painful. And then the medication might not be getting to them. And so it's not doing anybody any good. And so the concern of safety, is definitely a benefit for vitamin C. Probably wouldn't be any long-term usage needed. And then, vitamin C may not be, a sole solution, but it can definitely be kind of used adjunctively with other medications like metoprolol or statin. And so I think our articles obviously still point to some further research needed, but because of vitamin C's safe and inexpensive nature, and then its potential to help our patients, we believe it definitely deserves some further consideration in implementing this for our cardiac patients. But if anybody has questions, we will love to take them. Thanks for listening.